Today we're going to be talking about 10 commonly used medications in anesthesia. We're going to be talking about them in terms of what they're called, what their classifications are, typical concentrations that are used in anesthesia. We're going to talk about the infusion, bolus doses and ranges, the mechanisms of action, the onset time, and the duration of action of these 10 medications. The first medication we're going to talk about is phenylephrine. Phenylephrine is a synthetic non-catecholamine. It works by selectively agonizing alpha-1 receptors and has minimal beta adrenergic effects. And this results in arterial or vasoconstriction. So when we dose phenylephrine, it's usually done in concentrations of 10 milligrams in a 250 bag of crystalloid, which would make 40 micrograms per. Or you can put 10 milligrams in 100 milliliters of crystalloid, and that makes 100 micrograms per cc. The infusion dose typically starts between 20 and 200 micrograms per minute, and then for bolus dosing, it will be between 40 and anywhere between 200, 400, even 1,000 micrograms for bolus dosing. The onset time is less than a minute, and phenylephrine usually lasts a little less than 5 minutes. The next medication that we're going to talk about is ephedrine. Ephedrine is a synthetic sympathomimetic, and it works in two ways. One, it has a weak direct action where it agonizes alpha-1, beta-1, and beta-2 receptors, and then it has a much more powerful indirect action which releases endogenous norepinephrine. So ephedrine comes in two standard concentrations. It's either 50 milligrams put into 10 milliliters, which makes 5 milligrams per cc, or you can put the same 50 milligrams into 5 milliliters, and with that you get 10 milligrams per cc. So when you're giving an ephedrine bolus, it's typically done between 5 and 20 milligrams. The onset will be relatively short, between 1 or 2, at the most 3 minutes, and the duration will be between 10 and 60 minutes. The next drug we have to talk about is epinephrine. Epinephrine is a naturally occurring catecholamine. It directly stimulates alpha-1, beta-1, and beta-2 receptors for our primary effects in anesthesia. Typical concentrations of epinephrine, we take 1 milligram and put it in 250 mils of crystalloid to get 4 micrograms per milliliter, or we can take 1 milligram and put it in 100 milliliters of crystalloid to get 10 micrograms per milliliter. And then when we're dosing epinephrine, we can use rates between 2 and 20 micrograms per kilogram per minute for an infusion, or we can just do a pure bolus, and that we give 0.1 micrograms per kilogram usually. The onset of epinephrine is very quick, under 30 seconds, and the effects can last up to 10 minutes, or at least 10 minutes or so, and then up to 60 minutes. The next medication we're going to talk about is nitroglycerin. Nitroglycerin is a nitrodilator. It works by generating nitric oxide, which augments cGMP, and that produces vasodilation. Now, nitroglycerin is typically stored or mixed in a concentration of 25 milligrams per 250 milliliters of crystalloid, which makes 100 micrograms per cc, or you can use 50 milligrams in 250 milliliters of crystalloid, which makes 200 micrograms per cc. So your infusion dosing is going to be between 0.1 and 7 micrograms per kilogram per minute for nitroglycerin, or your bolus dosing is going to be between 0.5 and 1 micrograms per kilogram. The onset time is 1 to 2 minutes, and the duration is going to be 1 to 5 minutes. The next drug is sodium nitroprusside. Very similar to nitroglycerin, it's a nitrodilator as well. It works by generating nitric oxide, which augments the effects of cGMP, which produces direct peripheral vasodilation in the arteries and veins. The typical concentrations are 50 milligrams in 250 milliliters of crystalloid which makes 200 micrograms per cc. The infusion dose is between 0.25 and 5, or some sources say up to 8 micrograms per kilogram per minute, and bolus dosing is 0.5 to 1 micrograms per kilogram. The onset time is very rapid, 30 to 60 seconds, and it lasts between 2 and 10 minutes. The next drug is nicardipine. Now, nicardipine is a dihydropyridine calcium channel blocker. It works by binding to receptors on calcium channels, which results in the closure of the channel, and then it prevents calcium influx, and that limits the amount of contraction that vascular smooth muscle can have. So this drug is usually found in concentrations of, or created in concentrations of 25 milligrams per 250 mils of crystalloid, which makes 100 micrograms per cc. Now, the infusion dose is typically between 5 and 15 milligrams per hour, not usually given as a bolus. The onset time is less than a minute, and the duration is up to 3 hours. The next drug we're going to talk about is amiodarone. Amiodarone is a benzofuran derivative and a class 3 antiarrhythmic. It works by prolonging the refractory period in cardiac tissues by blocking potassium, sodium, and calcium ion channels. Amiodarone is typically found in 2 concentrations. The first is 150 milligrams in 100 milliliters of crystalloid, which makes 1.5 milligrams per. And then, for the second dose, it's in 900 milligrams of 500 milliliters of crystalloid, which makes 1.8 milligrams per. So when you're dosing amiodarone, we give 150 milligrams over 10 minutes, then we give 1 milligram per minute over 6 hours, and then finally we give 0.5 milligrams per minute over 18 hours. The onset of amiodarone is as low as 5 minutes, but it can be up to 30 minutes to an hour before you see the effects. And the duration, amiodarone has an incredibly long half-life of up to 60 days. Varies by some references, but generally quite a long half-life for amiodarone. The next drug is labetalol. Labetalol is a combined alpha-1 and beta adrenergic agonist. That's a non-selective beta adrenergic agonist, in fact. It selectively binds to alpha-1, beta-1, and beta-2 receptors and interferes with the ability of sympathomimetic medications or endogenous hormones to provoke responses at the alpha-1, beta-1, and beta-2 sites. Now, labetalol is kind of unique in that it blocks alpha and beta. In IV form, it blocks at a ratio of 1 to 7 alpha to beta. Usually you're going to find labetalol in concentrations of 100 milligrams and 20 milliliters of crystalloid, which makes 5 milligrams per cc. And bolus dosing is usually 0.25 milligrams per kilogram, which ends up being somewhere between 2.5 and 20 milligrams per dose. The onset time is between 2 and 5 minutes, and the duration is going to be up to 2, maybe 4 hours at the most. The next drug is esmolol. Esmolol is a selective beta-1 adrenergic receptor antagonist. It selectively binds with beta-1 and interferes with the ability of sympathomimetics to provoke responses at beta-1 adrenergic sites. You usually find esmolol in concentrations of, in a vial, it's 100 milligrams in 10 milliliters, which makes 10 milligrams per, or we can put it in a bag, or it comes in a premixed bag sometimes, of 2.5 grams in 250 milliliters, which makes it again 10 milligrams per cc. The infusion dose is anywhere between 150 and 300 mics per kilo per minute, and the bolus dose is going to be 0.5 to 1 milligrams per kilogram, which is usually given over a minute or so. The onset time is between 2 and 5 minutes, and the duration is anywhere between 10 minutes, sometimes up to 20 to 30 minutes, according to some sources. Usually we see around 10 to 15 minutes. The next drug that we're going to talk about is tranexamic acid. Now, tranexamic acid is a procoagulant, antifibrinolytic lysine analog. Basically, it inhibits the activation of plasminogen to plasmin, which allows fibrin clots to continue existing and not be degraded, which allows them to do their job and clot. Typical concentrations of tranexamic acid, otherwise known as TXA, are going to be 1 gram in 10 milliliters, which makes 100 milligrams per cc, or 5 grams in 50 milliliters, which makes, again, 100 milligrams per cc. The bolus dose is usually how we dose this medication, and that's going to be between 10 on the low side, 10 milligrams per kilogram for orthopedic cases, up to as much as 30 milligrams per kilogram for cardiovascular procedures. The onset time is anywhere between 5 and 15 minutes, and its effects last around 3 hours. So those are the medications that we have to cover today. I hope you enjoyed this presentation.